Chemotherapy is one of the most challenging experiences a person can go through. Not only does it affect the cancer cells, but it also impacts the entire body, physically, mentally, and emotionally. One of the most common questions cancer patients and their families ask is simple, but deeply important. What should I eat during chemotherapy? Nutrition does not cure cancer, and food is not a replacement for medical treatment. However, science clearly shows that what a patient eats during chemotherapy can influence strength, energy levels, immune function, treatment tolerance, and overall quality of life. In this video, we will explore what cancer patients should eat during chemotherapy, based on real medical knowledge and clinical nutrition principles, explained clearly, calmly, and responsibly. This is not about extreme diets, miracle foods, or fear-based restrictions. This is about nourishment, support, and helping the body cope with one of the hardest treatments it may ever face. Understanding what chemotherapy does to the body. To understand why nutrition matters so much during chemotherapy, it's important to understand what chemotherapy actually does. Chemotherapy works by targeting rapidly dividing cells. Cancer cells divide quickly, but unfortunately, so do many healthy cells in the body, including cells in the digestive tract, bone marrow, hair follicles, and immune system. Because of this, chemotherapy often causes side effects such as nausea, vomiting, loss of appetite, fatigue, taste changes, mouth sores, diarrhea, constipation, and weakened immunity. These effects can make eating difficult, yet the body's nutritional needs are actually higher during treatment. The goal of nutrition during chemotherapy is not perfection. It is about maintaining strength, preventing excessive weight loss, supporting immune health, and helping the body recover between treatment cycles. The role of calories and energy. During chemotherapy, one of the most important nutritional priorities during chemotherapy is ensuring enough calories. Many patients experience appetite loss, early fullness, or food aversions. When the body does not receive enough energy, it begins to break down muscle tissue, leading to weakness and increased fatigue. Calories are not the enemy during chemotherapy. In fact, they are essential fuel. Even patients who were previously advised to restrict calories or lose weight often need to shift their mindset during treatment. Maintaining body weight and muscle mass is associated with better treatment, tolerance, and recovery. Energy-dense foods such as healthy oils, nut butters, avocado, yogurt, eggs, and whole grains can help provide calories in smaller portions, which is especially helpful for patients who struggle to eat large meals. A critical nutrient for healing and strength, protein, is one of the most important nutrients during chemotherapy. The body uses protein to repair tissues, maintain muscle mass, produce immune cells, and heal from treatment-related damage. Chemotherapy increases protein needs because the body is under constant stress and repair. Good protein sources during chemotherapy include lean meats such as chicken and turkey, fish, eggs, dairy products like yogurt and cheese, legumes, tofu, and well-cooked beans. For patients who struggle with solid foods, protein can also come from smoothies, soups, or nutritional shakes. Protein does not need to be consumed in large amounts at once. Spreading protein intake throughout the day, even in small portions, can be more manageable and effective. Supporting energy and brain function. Carbohydrates are the body's main source of energy, especially for the brain and nervous system. During chemotherapy, fatigue is common, and adequate carbohydrate intake can help support energy levels and mental clarity. Whole grains, fruits, vegetables, and starchy foods like potatoes, rice, oats, and pasta are valuable sources of carbohydrates. However, tolerance varies from person to person. Some patients may find that refined carbohydrates, such as white rice or white bread, are easier to digest during treatment, especially when experiencing nausea or diarrhea. The most important factor is not perfection, but tolerance. Eating carbohydrates that the body can handle is far better than avoiding food altogether. Concentrated energy and nutrient absorption fats provide concentrated energy and help the body absorb fat-soluble vitamins, such as vitamins A, D, E, and K. During chemotherapy, healthy fats can be especially helpful for patients who struggle to meet calorie needs. Sources of healthy fats include olive oil, avocado, nuts, seeds, nut butters, and fatty fish, such as salmon. These foods can be added to meals in small amounts to increase energy intake without increasing meal volume. There is no scientific evidence that healthy dietary fats worsen cancer outcomes when consumed appropriately during chemotherapy. In fact, they can play an important role in maintaining weight and strength. Vitamins, minerals, and phytonutrients. Fruits and vegetables provide essential vitamins, minerals, antioxidants, and plant compounds that support overall health. During chemotherapy, they can help support immune function, digestion, and cellular repair. However, it's important to acknowledge that raw fruits and vegetables may not always be well tolerated. Mouth sores, digestive sensitivity, or weakened immunity may require adjustments. In these cases, cooked vegetables, peeled fruits, soups, and purees may be more appropriate. Food safety is also critical. Patients undergoing chemotherapy may have a weakened immune system, so fruits and vegetables should be washed thoroughly, and raw or unpasteurized products should be avoided if advised by the medical team. Managing common side effects. Through nutrition. One of the most practical roles of nutrition during chemotherapy is helping manage side effects. For nausea, small frequent meals, bland foods, ginger, and avoiding strong smells may help. Cold or room temperature foods are often better tolerated than hot meals. For mouth sores, soft foods such as yogurt, smoothies, mashed potatoes, oatmeal, and soups can reduce discomfort. Acidic, spicy, or rough-textured foods may need to be limited. For diarrhea, low-fiber foods, adequate hydration, and electrolyte replacement may be necessary. For constipation, fiber-containing foods and fluids can help, as long as they are tolerated. Every patient is different, and nutrition should always be adjusted based on individual symptoms and medical advice. Often overlooked but essential. Staying hydrated during chemotherapy is extremely important. Fluids help regulate body temperature, support kidney function, aid digestion, and help flush waste products from the body. Water is ideal, but other fluids such as herbal teas, broths, milk, diluted juices, and electrolyte drinks can also contribute. Some patients find it easier to sip fluids throughout the day, rather than drinking large amounts at once. Dehydration can worsen fatigue, dizziness, constipation, and nausea, making hydration a key component of supportive care during chemotherapy. Proceeding with caution. Many cancer patients consider vitamins or supplements during chemotherapy. While some supplements may be appropriate in specific cases, it is important to understand that supplements are not always harmless. Certain vitamins and herbal products can interfere with chemotherapy drugs or affect how treatments work in the body. For this reason, supplements should never be started without discussing them with an oncologist or registered dietitian. Whole foods remain the safest and most reliable source of nutrients during chemotherapy, unless a medical professional recommends otherwise. Diet myths and extreme claims. During chemotherapy, there is a lot of misinformation surrounding cancer nutrition. Claims that sugar feeds cancer, that specific foods can cure cancer, or that extreme diets are necessary during chemotherapy are not supported by solid scientific evidence. Restrictive diets can actually increase the risk of malnutrition, weight loss, and treatment intolerance. During chemotherapy, the priority is nourishment, not deprivation. Science supports balanced, flexible nutrition tailored to the patient's symptoms, preferences, and medical needs, not fear-based rules. The importance of personalized nutrition. Cancer is not one disease, and chemotherapy affects each individual differently. Nutrition during treatment should always be personalized. Factors such as cancer type, treatment plan, side effects, body weight, cultural preferences, and emotional well-being all matter. Registered dietitians specializing in oncology play a critical role in helping patients adapt their diets throughout treatment. Integrative oncology approaches often include nutritional support alongside medical therapy, recognizing that treating the whole person matters. Emotional and psychological aspects of eating during chemotherapy. Eating during chemotherapy is not just a physical challenge, it can also be emotional. Changes in taste, appetite, and body image can be distressing. Food, which once brought comfort or joy, may become associated with discomfort or frustration. It is important to approach eating with compassion rather than pressure. Even small amounts of food can be meaningful. Support from caregivers, family members, and healthcare professionals can make a significant difference. Nutrition during chemotherapy is not about control, it is about care. Please subscribe to the channel. Your support helps us continue creating calm, trustworthy videos designed to inform, comfort, and empower patients and families.